If you take amlodipine, losartan, or lisinopril, I want you to do something before this video ends. Do not stop your medication. Do not change your dose. Do not panic. But I want you to ask one question most people never ask. What is my blood pressure pill fixing, and what is it only hiding? Because that little pill you take every morning may be doing its job perfectly. Your numbers may look better. Your doctor may be satisfied. The nurse may say, "Great, keep doing what you're doing." But inside your body, there may still be a problem that the pill was never designed to fix. Your arteries may still be getting stiffer. Your kidneys may still be under pressure. Your sleep may still be driving your numbers up every night. Your diet may still be flooding your body with sodium. Your stress system may still be stuck on high alert. And because the pill lowers the number, you may think the problem is gone. That is the trap, not the medication. The trap is thinking the medication is the whole solution. Today, I'm going to explain what these 3 common blood pressure pills actually do inside your body, what they do not do, and the 7 questions every older adult should ask their doctor if they take one of them. And make sure you stay until number 1, because number 1 involves something millions of seniors take for pain without realizing it can quietly work against their blood pressure medicine. Before we begin, comment below and tell me which one you take: amlodipine, losartan, lisinopril, or something else. And if you know your age, write that too, because blood pressure treatment at 45 is not always the same conversation as blood pressure treatment at 75. I'm Dr. Young. Let's talk about what your blood pressure pill is doing and what you still need to pay attention to. Most people are taught to think about blood pressure as a number: 120 over 80, 130 over 80, 145 over 90, 180 over 100. So naturally, when the number goes down, they think the problem is solved. But high blood pressure is not just a number. It is a signal. It is your body telling you that the pressure inside your blood vessel system is higher than it should be. And that can happen for many reasons. Your arteries may be stiff. Your kidneys may be holding on to too much sodium and water. Your nervous system may be stuck in stress mode. Your sleep may be poor. Your weight may be putting extra strain on your heart. Your blood sugar or insulin may be affecting your blood vessels. Your diet may be working against you without you realizing it. The blood pressure reading is like smoke coming from under a door. The medication can reduce the smoke, but you still need to know what is burning. Now, let me be very clear. Blood pressure medications save lives. They lower the risk of stroke, heart attack, heart failure, kidney disease, and other serious problems. So this is not a video telling you to stop your medication. This is a video telling you not to let the medication become the only conversation. Because I have seen too many patients do everything right on paper. They take the pill. They refill it on time. They show up for appointments. Their number looks better, but they are exhausted. Their legs are swollen. They are dizzy when they stand. They have a cough nobody explains. They take ibuprofen every day. They have sleep apnea that nobody checked. They have kidney numbers that haven't been reviewed in too long. And nobody connects the dots because everyone is staring at one number. So let's stop staring only at the number. Let's look at the whole person. If you take amlodipine, losartan, or lisinopril, you may think all blood pressure pills work the same way. They do not. These 3 medications lower blood pressure in very different ways. Amlodipine is a calcium channel blocker. That means it helps relax the muscle in the walls of your blood vessels. When those vessels relax and open up, pressure can come down. Think of it like loosening a tight garden hose. The water can move through more easily. That is why amlodipine can be very effective. But because it relaxes blood vessels, fluid can sometimes pool in the lower legs. That is why some people notice swelling in the ankles or feet. Losartan is an ARB, an angiotensin receptor blocker. Your body makes a hormone signal called angiotensin II that tells blood vessels to tighten. Losartan blocks that signal. So instead of your arteries clenching, they can relax. Lisinopril is an ACE inhibitor. It works earlier in that same system. It reduces the production of the hormone signal that tightens blood vessels. That is why losartan and lisinopril are cousins in a way. They are not the same drug, but they work in the same blood pressure control system. And this is why your doctor may check kidney function and potassium when you take these types of medications. Not because they are bad. In many patients, these medicines are protective, but they affect a system that involves the kidneys, sodium, water, and potassium. That means monitoring matters. Now here is where people get into trouble. They know the name of the pill, but they do not know the questions to ask. So let's go through the 7 things I want every senior taking these medications to understand. Number 7. Swelling is not something to simply live with. If you take amlodipine and your ankles or feet started swelling, do not just assume it is normal aging. And do not respond by drinking almost no water. That is a common mistake. A patient sees ankle swelling and thinks, I must be holding too much fluid. I should drink less. But if you are older, restricting fluids too much can make you dehydrated. And dehydration can make you dizzy, weak, constipated, confused, or more likely to fall. The swelling needs a conversation, not guessing. Ask your doctor, could my ankle swelling be related to amlodipine? And then ask, what should I do about it? Sometimes the answer may be adjusting the dose. Sometimes it may be changing medication. Sometimes it may be checking for heart, kidney, or vein problems. Sometimes the swelling may have another cause entirely, but do not ignore it. And do not quietly suffer because you think side effects are the price of getting older. Getting older does not mean you stop reporting symptoms. Your symptoms are information. Now, number 6 is about something people feel in their throat and lungs, but it may start with the pill bottle. Number 6. A dry cough deserves attention. This is especially important if you take lisinopril. ACE inhibitors like lisinopril can cause a dry, irritating cough in some people. Not always, not everyone, but it happens often enough that anyone taking lisinopril should know about it. The problem is that many people live with that cough for months or even years. They blame allergies. They blame dust. They blame age. They blame the weather. They take cough drops and keep going. But the question they never ask is, could this cough be related to my blood pressure medication? That one question can change the entire appointment. I remember a woman who told me she had been coughing for so long that she stopped going to church because she was embarrassed. Every time the room got quiet, she felt the tickle start. She thought it was her lungs. But when her medication history was reviewed, the timing made sense. The cough had started after she began an ACE inhibitor. Her doctor changed the plan and the cough improved. That does not mean every cough is caused by lisinopril. A cough can come from reflux, asthma, infection, heart problems, allergies, smoking history, or something more serious. So do not diagnose yourself. But do not ignore the connection either. Ask, could my cough be related to lisinopril? And are there alternatives if it is? That is a fair question. Now, number 5 is one of the most important for older adults, because this one can lead to falls. Number 5, dizziness when standing is not harmless. If you stand up from a chair and the room tilts for a few seconds, do not brush that off. If you get lightheaded walking to the bathroom at night, do not ignore it. If you need to hold the wall after standing, your body is telling you something. Blood pressure that is too high is dangerous, but blood pressure that drops too low at the wrong moment can also be dangerous, especially for older adults, because dizziness can lead to falls. And for a senior, a fall is not a small thing. A fall can mean a broken hip, a head injury, a hospital stay, loss of independence, fear of walking alone, a life that becomes smaller almost overnight. This is why your blood pressure number should not only be checked while you are sitting calmly in a clinic chair. Sometimes it needs to be checked when you are standing. Ask your doctor, should we check my blood pressure sitting and standing? And if you feel dizzy, bring dizzy. When does it happen? Morning or night? After meals? After taking medication? When getting out of bed? After dehydration? After alcohol? After a hot shower? These details matter. Do not say, I'm just dizzy sometimes. Say, I get lightheaded when I stand up, especially after taking my medication. That gives your doctor something useful. And please hear this clearly. Do not stop your medication on your own because of dizziness. Suddenly stopping blood pressure medication can be dangerous, but do report it. A good blood pressure plan should protect your heart and your brain without making you afraid to stand up. Now, before we move to number 4, I want you to notice the pattern. These are not reasons to fear your medication. These are reasons to have a better conversation. That is the whole point of this video. Number 4, your kidneys should not be forgotten. Blood pressure and kidney health are deeply connected. Your kidneys help control fluid, sodium, and blood pressure. At the same time, high blood pressure can damage the kidneys over time. That means when you take certain blood pressure medications, especially medicines like Lisinopril or Losartan, your doctor may need to monitor kidney function and potassium. Again, this does not mean the medications are harmful for everyone. In fact, for many people, ACE inhibitors and ARBs are used because they can help protect the kidneys, especially in certain patients with diabetes or protein in the urine. But protection still needs monitoring. Think of it like driving with headlights. The headlights help you drive safely, but you still need to look at the road. Ask your doctor, when was my kidney function last checked? And ask, what was my creatinine or eGFR? Then ask, has my urine been checked for protein? Those are not random medical words. Creatinine and eGFR help show how well the kidneys are filtering. Protein in the urine can be a sign that the kidneys are under stress. You do not need to become a kidney specialist, but you do need to know whether anyone is watching the kidneys while treating the pressure. This is especially important if you have diabetes, are over 60, take multiple medications, use anti-inflammatory pain relievers, or have ever been told your kidney numbers are a little off. Do not wait until someone says kidney disease to start asking kidney questions. Now, number 3 is where a lot of people accidentally work against themselves at the dinner table. The salt problem is bigger than the salt shaker. Number 3, the biggest salt problem is usually not the salt shaker. Many people say, I don't eat much salt. Then I ask what they ate yesterday. Canned soup, deli meat, frozen dinner, crackers, restaurant food, bread, sauce, pickles, packaged snacks. And suddenly, the problem becomes clear. Most sodium does not come from the little shaker on the table. It comes hidden inside processed food. That matters because sodium affects fluid balance. More sodium can mean more water retained in the bloodstream, and that can push pressure higher. So your medication may be trying to lower pressure while your food keeps pushing it back up. That is a frustrating tug of war. And many people are losing it without knowing why. Here's the practical move. For the next 7 days, look at labels. Do not even change anything yet. Just look. Look at the sodium number on your soup, your bread, your salad dressing, your frozen meals, your seasoning blends, your sauces, your lunch meat. You may be shocked. Then ask yourself, what are the 3 highest sodium foods I eat every week? Start there. Not with a perfect diet. Start by replacing the worst 3. And be careful with salt substitutes. Some salt substitutes are high in potassium. If you take Lisinopril or Losartan, potassium can be a serious conversation because those medications can raise potassium in some people. So do not switch to a potassium salt substitute without asking your doctor. This is where many healthy changes can become risky if nobody explains the medication interaction. The safer general direction for many people is simple: more fresh food, more home-cooked meals, more fruits and vegetables if your doctor says your potassium is safe. Less packaged food, less fast food, less processed meat, less sodium you cannot see. Do not chase a miracle. Remove the daily pressure. Now, number 2 is the one most people never connect with blood pressure at all. Number 2, your blood pressure may be rising while you sleep. This is one of the most overlooked causes of difficult blood pressure control: sleep apnea. A person with sleep apnea may stop breathing again and again during the night. Every time that happens, oxygen can drop and the body can release stress hormones. The heart works harder, blood vessels tighten, blood pressure rises. Then the person wakes up exhausted and says, "I slept 8 hours. Why am I so tired?" Because sleep time and sleep quality are not the same thing. Here are clues that sleep apnea may be part of the picture: loud snoring, waking up gasping, morning headaches, dry mouth in the morning, daytime sleepiness, high blood pressure that is hard to control, needing naps even after a full night in bed, a spouse saying, "You stop breathing at night." And if you live alone, you may not know you snore or stop breathing. That makes the daytime symptoms even more important. Here are clues that sleep apnea may be part of the picture: loud snoring, waking up gasping, morning headaches, dry mouth in the morning, daytime sleepiness, high blood pressure that is hard to control, needing naps even after a full night in bed, a spouse saying, "You stop breathing at night." And if you live alone, you may not know you snore or stop breathing. That makes the daytime symptoms even more important. Ask your doctor, could sleep apnea be contributing to my blood pressure? And should I have a sleep study? This question is especially important if you have high blood pressure plus fatigue, obesity, a large neck size, morning headaches, or nighttime breathing symptoms. Some people keep increasing blood pressure medication while the real nighttime driver is never addressed. That does not mean sleep apnea is always the answer, but it should not be ignored. Now we are at number 1. This is the one I told you to stay for, because it is sitting in medicine cabinets all across America. It is not a blood pressure pill, but it can interfere with blood pressure treatment and put extra strain on the kidneys. Number 1. Common pain relievers can work against your blood pressure plan. I'm talking about NADs, ibuprofen, naproxen, the pills many people take for back pain, knee pain, arthritis pain, shoulder pain, and old injuries. These medications can be useful for some people in the right situation. But if you have high blood pressure, kidney disease, heart disease, or you take medications like Lisinopril or Losartan, you need to be careful. NADs can raise blood pressure in some people. They can reduce the effect of certain blood pressure medicines, and they can put added stress on the kidneys, especially in older adults, people who are dehydrated, people taking diuretics, or people with kidney problems. This is the part many seniors are never told clearly. They take their blood pressure pill in the morning. Then they take ibuprofen for joint pain. Then their blood pressure stays high. So the doctor increases the blood pressure medication. But nobody asked about the pain reliever. That is how the cycle starts. So here is the question to ask. Is it safe for me to take ibuprofen or naproxen with my blood pressure medication and kidney history? Do not assume. Ask. And tell your doctor how often you take it. Not once in a while if you take it 5 days a week. Be honest. Your doctor cannot protect you from a medication they do not know you are using. And this includes over-the-counter pills, supplements, powders, herbal products, and salt substitutes. If it goes into your body, it belongs on your medication list. Now, before I give you the practical plan, hit the like button if this has already made you think of one question you need to ask your doctor. Because there are millions of people taking these medications correctly, but without the full conversation. And subscribe if you want health information that helps you ask better questions before something goes wrong. Now let's put this into action. Here's what I want you to do this week. Not forever, just for 7 days. Call it your blood pressure review. Step 1. Write down every medication and supplement you take. Prescription medications, over-the-counter pain pills, vitamins, sleep aids, herbal products, salt substitutes, anything you take even a few times a week. Bring that list to your doctor or pharmacist. Step 2. Check your blood pressure at home properly. Sit quietly for 5 minutes. Feet on the floor, back supported. Arms supported at heart level. No talking. Use the right cuff size. Take 2 readings, 1 minute apart, and write them down. Do this at the times your doctor recommends. Do not obsessively check it every hour unless instructed. That can create anxiety and misleading numbers. Step 3. Write down symptoms: swelling, cough, dizziness, leg cramps, fatigue, shortness of breath, chest discomfort, palpitations, confusion, falls or near falls. Do not just say, "I feel off." Write what happened and when. Step 4. Check your food labels for sodium. Find the 3 biggest sodium sources in your week. Replace those first. Do not try to become perfect overnight. Step 5. Ask whether you need updated labs: kidney function, potassium, blood sugar or A1C, cholesterol, possibly magnesium or other tests if your doctor thinks they apply. Step 6. Ask about medication timing. Now, this is important. Do not change from morning to night on your own. Some people do better with one schedule, some do better with another. Some medications may be better at certain times because of side effects, bathroom trips, dizziness, or other health conditions. Recent large studies have not shown that everyone should automatically take blood pressure pills at bedtime. So the right question is not, should I switch to night because a video said so? The right question is, based on my readings and symptoms, is my current medication timing right for me? That is a smarter conversation. Step 7. Ask whether the cause has been fully explored. Say this: my blood pressure is being treated, but have we looked at what may be driving it? Then discuss sleep apnea, weight, sodium, alcohol, stress, kidney health, diabetes or insulin resistance, physical inactivity, other medications that raise blood pressure. That conversation can change your care, because the goal is not just lower numbers. The goal is fewer strokes, fewer heart attacks, fewer falls, better kidney protection, more energy, more years where you can live independently. That is the real goal. Now, I need to say this clearly. Some symptoms should not wait for a routine appointment. If your blood pressure is extremely high, especially around 180/120 or higher, follow your doctor's instructions and seek urgent medical advice. If that high reading comes with chest pain, shortness of breath, severe headache, confusion, weakness on one side, trouble speaking, vision changes, fainting, or severe back or jaw pain, call emergency services. Do not drive yourself. Do not wait to see if it passes. If you have signs of a stroke, every minute matters. If you have chest pressure that lasts more than a few minutes or spreads to your arm, jaw, back, or shoulder, get emergency help. No home protocol replaces emergency care. No YouTube video replaces a doctor. And no one should stop blood pressure medication suddenly without medical guidance. That can be dangerous. The purpose of this video is not to make you afraid of your medicine. It is to make you informed enough to use it wisely. So let's bring this together. If you take Amlodipine, Losartan, or Lisinopril, your medication may be helping you, but it may not be solving everything underneath. Amlodipine helps relax blood vessels, but swelling should be discussed. Lisinopril can help blood pressure, but a dry cough may be related. Losartan and Lisinopril can involve kidney function and potassium, so monitoring matters. Dizziness when standing should never be ignored, especially in older adults. Hidden sodium can fight against your medication every single day. Sleep apnea can drive blood pressure up all night while you think you are resting. And common pain relievers like ibuprofen and naproxen can interfere with blood pressure control and kidney safety in some people. The question is not, is my medication good or bad? That is too simple. The better question is my whole blood pressure plan protecting me? Because a real plan includes the medication, but it also includes your kidneys, your sleep, your food, your pain relievers, your symptoms, your home readings, your fall risk, and your life. So here's what I want you to do today. Write down these 5 questions. Could my symptoms be related to my medication? When were my kidney function and potassium last checked? Are any of my pain relievers or supplements interfering with my blood pressure medicine? Could sleep apnea be driving my blood pressure? Is my current blood pressure target and medication timing right for my age and health? Take those questions to your doctor or pharmacist, not as a challenge, as a conversation. Because the patient who asks better questions gets safer care. If this video helped you, hit the like button so it reaches someone else who takes one of these pills every morning and has never been told the full story. Subscribe for more clear health education for older adults and the people who love them. And comment below with the name of your blood pressure medication: Amlodipine, Losartan, Lisinopril, or something else. I want to know what most of you are taking so I can make the next video even more useful. This video is for education only and does not replace medical advice. Do not stop, start, or change any medication without speaking with your healthcare professional. I'll see you in the next video.